to weigh in here. Dr. Evans, you recently now in this new elevated role, acting as the program executive director, and we really appreciate that. And had a lot of key assignments over there at VA, a lot of things going on over there. Give us a state of the state about what's happening with the electronic record modernization effort.
Sure. As you mentioned, there is an awful lot going on at VA. And I guess one of the things that excites me is when we're talking about health information technology in government, what's happening in VA is actually broader across the government. I think you've heard this in the comments here. We've already talked about data sharing. Ryan talked about data sharing with the community, Carl with data sharing in between agencies, HHS and VA. When we talk about the electronic health record modernization project in VA, it's not just actually a VA project. It's about implementing a federal electronic health record, which is now live across and being used by 4 separate cabinet level agencies: the Department of Veterans Affairs, the Department of Homeland Security, the Department of Commerce, and the Department of Defense, all using the same common record. The Department of Defense has nearly completed their implementation. The Coast Guard has fully implemented the record, as has the National Oceanic and Atmospheric Administration and the Department of Commerce. And VA is in the process still of implementing the record, building a common record for members of the military all the way through their veterans service. Really an exciting project. But that's just one piece of what we're doing with regard to health information technology in VA. I'll give you another just quick example. This year, in just a couple months ago, May of 2023, was the 20th anniversary of VA telehealth services in VA. And just to give you an example of the level of engagement that we're seeing still with telehealth as we've grown over 20 years, 2.3 million veterans took part in over 11 million episodes of care last year with high levels of satisfaction and engagement. And this is even as we've moved to this point, early in the pandemic, we had incredibly high levels of engagement, but we're still doing 180,000 Vizio visits per week across the enterprise, indicating a real sustained demand for technology-enabled care, even here on the backside of the COVID-19 pandemic. So a lot of exciting work, many other areas I can highlight, but I'm sure we'll have time as we move forward.